Hello, my WomenLift sisters and friends. My name is Rena Greifinger, and I am the Managing Director of the Maverick Collective by PSI, a community of women philanthropists making catalytic investments in health and reproductive rights to lift up women and girls everywhere. Today, I'm going to talk about reimagining philanthropy because, let's face it, if we want to change outdated and male-dominated systems like healthcare, social, and gender norms, we have to acknowledge the system of philanthropy is equally flawed. Despite philanthropists' good intentions, too many decisions about funding and impact are made by donors rather than communities. Nonprofits get strapped with short timelines, intense reporting requirements, and donor inflexibility, meaning we rarely have the time or space to get to root problems. And historically, it's the big dogs like my own organization that dominate in donor circles, leaving out the community-based organizations and movements that play such an essential role to changing systems and norms. We need more donors that share power, invest in systems change, and embrace effectiveness. Armed with this mission, and as part of my WomenLift leadership project, my team and I have spent the last year leading an agile design process with input from over 60 global health professionals, philanthropists, activists, and young people to design a unique philanthropic vehicle that combines the rigor and scale of PSI with the powerful voices of intersectional feminist movements and bold, curious women donors who want to change the status quo. This is the Maverick Portfolio, a philanthropic fund for PSI to work hand in hand with grassroots feminist organizations to tackle systemic barriers to women and girls accessing sexual and reproductive health care. The model aims to disrupt traditional power dynamics in philanthropy. First, it centers women. Secondly, it brings donors into a co-investment community where their funding, risk, and learning is shared. The portfolio shifts decision-making power about where and how to spend the money to those who are delivering the programs. Funding is flexible, allowing teams to invest in areas that more traditional donors often shy away from. We are thrilled to partner up on this initiative with Fos Feminista, an international feminist alliance of more than 170 local organizations dedicated to achieving sexual and reproductive health and justice around the world. Through a long and deeply collaborative process, we landed on the first 3 countries where we will launch the portfolio. And for at least the next 3 years, we will be working in Cote d'Ivoire, Malawi, and Uganda. Over the next month, PSI teams and Fos Feminista partners in the countries will come together and decide on a cross-cutting theme that they want to address, each using a diversity of approaches, but tied together through a single theory of change. The theme will be something that is cross-cultural, deeply rooted, and with catalytic potential. Themes being discussed are creating integrated and holistic healthcare approaches, tackling stigma and harmful norms, transforming the role of men and boys, and designing client-centered health systems. Over the next 5 years, we aim to raise $25 million to fund portfolio initiatives and hope to raise 10% of that in year 1. With seed capital from a group of angel investors who are passionate about being on this learning journey with us, we're more than halfway there. As the leader of the Maverick Collective, I know that my sphere of influence is small compared to the challenges we face in global health. But I also know that this sphere is mighty. For despite its inherent flaws, philanthropy's potential for creativity, flexibility, and risk tolerance is unparalleled and can pave a path for government and business to follow. And I believe women are the catalysts in philanthropy's reimagining. I take away from this journey a deeper understanding of how to bring my full and authentic self to the work, recognizing my own given power and privilege and the ways in which I can put that privilege to work for women and girls. I take away the validation that my inclination to challenge the status quo and inspire change is not only something I should nurture, but pay forward to others. The Maverick Portfolio is really a laboratory to test all that we've learned about in WomenLift: authenticity, inclusivity, trust, mutual accountability, and change-capable leadership, working at the intersection of people and process. If we can prove this model at PSI, we've got a template for global health organizations and donors everywhere. Thank you so much for the opportunity for this leadership experience, and especially to my incredible cohort, who I admire and respect so deeply. I look forward to a lifetime of supporting one another.